but we are very hopeful.
We're very, very hopeful. We
What,
all
what are you discussing with the patient right now? Because it's difficult for you to diagnose and see the patient. So, what kind of consultations or positiveness you are sharing with your patients and around the world at this point of time? Because everyone is in a bad situation and everyone is mentally and physically exhausted. But still, we have to be hopeful and try our best shot to fight with this pandemic.
So I'm trying. The first thing I'm focusing on is reassurance to the patients that we'll be fine. We'll pull through this difficult time. In terms of patients with chronic and cancer pain patients do need opioid, so we keep refilling them as and when required. In chronic pain patients, we are encouraging them to be doing exercises, to take precautions, to build up their immunity, to be positive in a positive frame of mind. So, as doctors, we are just encouraging patients and just motivating them and just reassuring them that everything will be fine.
Great. And how soon you think you will be back on the OPD side of it? Because we haven't seen any kind of guidelines for doctors that how soon they can start the OPD, or you are still looking to do the online thing?
We are doing the online thing, and I'm also doing the one-to-one OPDs also with proper social distancing and proper PPE and everything. So, but from 20th of this month, our hospital is going full blown on. So we are taking all the precautions. We are starting all our services back to normal because that's very reassuring and encouraging for the patients. The doctors are there available for them. So that is the best way out. We need to fight out. We can't sit at home and give a negative feedback to the patients.
And what's your advice for patients who are suffering from some kind of a pain in this scenario and they haven't seen a doctor, or maybe it's difficult for them to reach out to a doctor? Maybe cancer patients, or maybe a general pain thing, because as what I was discussing with Kimberly before the show, that I mean, sitting at home, it's little exhausted because you are not able to go out, and then mentally and physically, you feel that there is some kind of a pain going on, and you are not feeling the way you should feel. Although after decades, I've seen a rainbow in Delhi, so that was a good positive sign for us. But still, I mean, there are a lot of things going around.
See, chronic pain patients, there's a huge psychological aspect associated with chronic pain patients. So definitely this time sitting at home, a lot of negative vibes comes into you and the pain definitely increases. So we are just trying to motivate them to exercise, give them telephonic consultation. And in terms of cancer pain patients, these patients have real, genuine pathological pain, and so they need opioid supplements. So we are not discouraging them. We are giving them as and when required. We are refilling them more than they require, so that they are not short of medications. And we are 24/7 available for cancer pain patients.
Okay. And if someone wants to reach out to you, because a lot of our viewers would like to reach out to the doctor. So, I mean, I know that you know that we are planning a show with you on cancer and pain management. Apart from that, if someone wants to reach out to you, what are the best options for viewers and people around the world?
They can visit my website. It's www.orlinclinic.com, and they can also WhatsApp me or make a WhatsApp call to me at my number. So probably, if you want, I can put in the information, or you also have my information. You can put it across.
So I'll just rotate the ticker for our audience so that if someone wants to reach
What
out
is
to
your opinion on all of, everybody keeps saying testing, testing, testing. I'm not 100% on board with it because I feel like it's going to give us a false illusion of a lot of people being negative and maybe potentially getting out there being a little reckless. But what is your thoughts on the testing process?
I personally feel that we should be more judicious in our approach to testing. We just cannot go full fledged out and do testing for everybody because there are a lot of people who are scared. So they've been visiting, they've been using the testing kits, especially in countries like India, where we have limited testing kits. We just can't use it for every patient. So we have to be more selective in choosing our patients. A patient with a positive history, a patient with positive symptoms, and not recovering, then only we should think of doing testing for these patients. Just because we suspect a patient might be suffering from COVID, we cannot do testing for all the patients.
No, it's a bit unrealistic to say we can do testing for all of the patients. I think that we're going to have to come to a re-entry into the world. Basically, we're going to have something that maybe test our immunity systems to make sure that we are higher in immunity. I think this is a reset button, not just for the world, but for humanity to become a little more healthier and mindful of our health. And I think those are the processes we're going to have to come to re-enter. I am a patient at a pain clinic. I receive treatments once a month, and it's very challenging to have to remain home. I don't want to risk infecting my doctors or making them sick, nor do I want to go there and somebody be sick and infect me. I've stayed locked down now for probably 7 or 8 weeks. So I locked down before Trump said lockdown. And because I was watching the rest of the world. And to me, the message from the rest of the world was you need to stay home. But for patients, you're like you said, you're prescribing medications that they can get to last through this, that they're not panicked about it. But what about patients who receive physical treatments or physical therapy? What are some things that you can recommend them?
See, patients who are doing physical therapy, we encourage them to do that at home. We are sending them exercise charts. We are sending them videos. We have made personalized videos, and we are sending to each and every patient. So there has been a lot of debate in the pain fraternity regarding whether we should go on and treat such patients or do interventions at this time. So they specifically said that patients who are in dire need, who are going to the ER with bothersome pain or they are not able to manage, then only we should consider doing an intervention. But even we know that opioid narcotics is a epidemic in states, so people are very reluctant in prescribing narcotics. But we have to pull through this difficult time, and it is better to prescribe them narcotics rather than calling them to the ER and increasing the patient load on the doctors there. So it's like catch situation. So encourage people who are managing well and people who are smart enough like you. So you should be more encouraged to do exercises at home with the help of videos, charts, but don't encourage them to come to the hospital.
No, and I'll tell you, living with the disease I live with and the pain that I can endure at times, I chose not to become addicted to opioids. They would prescribe me handfuls if I wanted it, but I choose not to. I learned something very valuable a few years ago. Pain psychologist, right? Somebody, and maybe we can line something up via phone for people, because one of the things that happens when you endure a lot of pain and live in a life of it, and there's not a lot of light, to see past, is mental therapy really helps a lot. Depression can cause you to feel worse. You're not going to want to do your therapy, and you won't get better. You'll get worse and worse. So maybe some psychology sessions that can be allowed. I know that pain psychologists helped me through a lot. It helped me think past the pain. It helped me stop thinking selfishly. Even though I knew there were people out there worse off than me, but when you start getting depressed and things like that, you're not healing. You're not sleeping. Sleep is a important part of any kind of pain treatment. And if you're not getting good sleep, you're not going to get past that. And there are just some pains you're not going to live past through, right? But pain psychology helped me a lot. And it wasn't like meditating that, they recommended meditating, but it was finding things to preoccupy your mind, right? first you learn to accept it, and then you learn to live with it, and then you learn to preoccupy your mind. And but with positive things, not with negative things, right? And that's I found a huge just retreat with that, and it helped me breathe again. Sometimes my neurological system shorts out. I have very good lungs. Everybody thinks it has something to do with allergies, but it's not. When it shorts out, my respiratory system feels like it's crushing, and it's very, very hard to breathe. And I've learned not to panic. Right, that helps, because when you panic, that didn't help my situation at all. But to get past this is going to be a challenge for me, because I can't go in and get my treatments. But I appreciate your wise words. Are there thoughts about opening up lines for pain psychology, or just for patients to call in and talk?
Surely, that's a good idea. When I was being trained in McGill way back in 2014, so we started this online support groups for psychology patients, and definitely they do help. So that's a very good idea to
Yeah.
start a support group online.
I mean, this is depressing enough as it is, right?
It
but,
is.
but at least you got a beautiful smile and you're very happy. What are you doing day by day? What do you do every day to?
It's so lovely to hear a patient in pain, so motivating and so encouraging. You breathed out, you summarized everything what a chronic pain patient needs to do, and so it brings a smile on my face as I feel so happy. So
Oh,
that's all. So talking to the patients, getting good feedbacks is very encouraging for doctors, for sure.
well, and I thank you for being a doctor, because it's got to be challenging right now not to be able to physically be with your patients, because you got into this profession because you wanted to heal people. And it's got to be extremely frustrating on your end. Um, what are some of the things that you're doing just for you now? Now that you're maybe home, maybe less driving, are you able to do some things for yourself?
Listening to music, singing, spending time with kids, drawing, coloring with them. So that's how keeping ourselves busy and reliving our childhood again.
That's a good way to look at it. Now, with children, do they ask you a lot of questions about why am I having to be locked down? Why am I not going to school? Are they asking you a lot of these questions?
They are more concerned about why, Papa, you're not going to hospital. So they are not used to seeing me at home. So that's the frontline question to me. So they're very happy not going to school, but they're not happy seeing me at home because I'm
Oh,
after them.
oh,
So, but it's lovely. It's an awesome time. But so that's all what is positive, and that's how I'm keeping myself motivated.
are you doing a lot of research and talks about the COVID-19, about just what the patients are going through, and are these going to become patients that are going to need help after they recovered? Are they going to be experiencing lifelong pains? Is there any talk about that?
Not much, not much. People who have recovered are pain is not a major symptom in COVID-19 patients. So I don't see it as a sequelae of patients who have recovered. So thankfully, unlike other pains, post fever like chikungunya, which is very predominant in India, so they have bad joint pains. But I don't see any patient with pain recovered after COVID-19.
Well, that's a relief. I mean, that's a positive. That's the first positive I've heard about after COVID, right? We're also, so many people are so worried about the economics of things, and I think economically we will heal, but we have to heal our bodies in order to enjoy the economic challenges that we're going to have in the coming futures. Speaking of music, we're going to be starting a music show next week, and for children too. It's a young girl. She's in South Africa. She's going to have an hour morning show. Mondays and Wednesdays, and then Sunday evening. So your children could watch Sunday evening. She's going to teach about writing songs and get writing songs going. Yeah, she's very, very talented. She's very youthful and energizing and exciting. So you might want to recommend your children to listen, because music is healing. Sasha Starr has a question.
Yes, I have a question. Hello, Dr. Gupta. I have a question. As lately, I was trying to educate myself as much as possible about coronavirus and how it affects different groups of people. And I stumbled into something very interesting, and I'd like to know your opinion. That people of so-called Tika are much more immune to coronavirus than other people. First of all, I was working very hard to understand the meaning of Tika. And in Wikipedia, it gives meaning that it's kind of a Nepal Buddhist uh, uh, religion, or some kind of a part of a Buddhist religion. So I'm struggling to find more information. I don't know if you're familiar with, first of all, Tika and why they are more immune than others.
See, to be very honest, I'm not very familiar with the word and this research. But what I am listening across and reading across is people from India and people from a few other Asian countries are seen to be more resistant or to coronavirus because of they receiving a tuberculosis vaccine called the BCG vaccine at the time of birth. And this is one breakthrough which might come along as the time goes on, that BCG vaccine might be helping patients to be immune to corona. So these are scientists are working on that. So probably we are on those lines that might be a reason why our country is not having those high numbers as compared to other Western world. But again, still it's into research. Don't quote me anywhere, but this is what's going on.
So there are actually, you raised two issues. Issue number one is that the people associated with the Buddhism, and not necessarily in India only, but also in Southeast Asia, they're more resistant, and the Buddhism is I'm studying about Buddhism, but I'm still know very little about it. But it seems to me that my daughter is actually, she's practicing yoga and Buddhism. So what she's telling me is that because of special way of life, mental health, even what you eat, for example, exercises of different kinds, so that helps resistance. Now, speaking about the tuberculosis vaccine, um, it's been investigated in Germany that older people, more mature people who were raised in Eastern Germany when it was part of a Soviet bloc, they were
Mm.
getting vaccines, and it's been calculated that they're way more resistant than people in similar age Western Germany, or what used to be Western Germany, now it's Germany, and there they didn't get this vaccine. And so in people who were raised in Eastern Germany, they're more resistant. Do you think it's a valid point?
Could be. That's what I'm saying. That's what we are working on. So that's still into research, and that's what our scientists are working in the labs, finding out if corona and tuberculosis have some common link in. So that's what we are working on, and hopefully you should hear good news very soon.
Okay, my final question. What
Yeah.
type of music do you like to listen to?
What types of news do I like to listen to?
Yes.
I spend most of my time reading about medicine. So whenever I get time, I'm do updating myself with the corona news. But otherwise, I'm not very keen in listening to the general news.
No, no, you mentioned before that you're listening to music. So
Music. Oh yeah.
yeah, I was
Sorry,
wondering
I
what
heard
type of
news.
music are you listening to?
I'm listening to Indian music, Hindi Bollywood music, old classical music. That's what I'm very fond of. Have you heard of Bollywood music?
Which music?
The Indian music, the Bollywood music.
Um, I'm familiar with Indian music. I've studied music a lot. I'm familiar with Indian music. The Bollywood music, in my opinion, it's more popular music, but has elements of Indian folklore music. Uh, I'm actually, I have one question about music is, you see, obviously 99% of what I've studied and learned about music, it's obviously Western classical music. And it seems to me when it started with, say, Italian masters in 16th, 17th century, and it came a full circle into avant-garde 20th century music. Uh, and although there were experiments to expand farther, like those Schoenberg, for example, and many others, Berg and others, there are limits of human ear, what it can absorb. And it seems to me that the human ear was, should I say, designed a certain way that it can accept certain type of music up to probably the end of maybe 19th century classical music, with exception of perhaps Rachmaninoff and few others who wrote a lot in the 20th century. Now, but then it cannot move forward anymore simply because of the limitation of human ear, what it can absorb, because atonal music, for example, so on, the human ear just can't absorb. So that's there is a big a problem with the development of further of classical music. And I remember when I was younger, of course, I was composing music. And one big problem that I have to motivate myself to compose was that, wow, with the music of Bach, Beethoven, Rachmaninoff, who needs any new music? It's all done. Just listen to it. It's impossible to come up with anything viable and worth listening to. Now, I'm wondering, people who are not accustomed necessarily to Western classical music, but for example, Indian music, do they have also same limitations? Is it developing still further and people can actually absorb it?
People can actually absorb it. So I probably would not be able to make the right comment regarding this question. But I feel that Indian music is, again, following the footsteps of the Western music. So let's see how long we can absorb. But
Mhm.
no comments on this.
Yeah. Okay, Dr. Gupta, thank you very much.
Thank you, sir.
You answered my questions.
That's good rapid fire done by Fasha for Dr. Rajat, and that was very interesting. So, Dr. Rajat, also, I mean, people would like to know that all these therapy centers are closed, and I mean, they just have to stuck at their home and do the exercise what they can on whatever the doctors are sharing with them. So, can you share some exercise for the patients so that they can at least try to do it so that they can be fit and stay healthy in this lockdown?
I'll be putting within next 24 to 48 hours core strengthening, back strengthening exercise video on my Orlin Clinic YouTube page. So people should go there and visit. Following that, I'll be putting the neck exercises, the knee exercises. So probably in the next couple of days, I will be putting on all these videos, and with the help of my children, of course. So they are very motivated, and we are doing this exercise regime, and we'll be putting it on. So definitely, whoever is interested can visit my YouTube page, Orlin Clinic.
And if you can share those videos
That's right.
with us, we'll put it on IBM TV as well. As our viewers know that we are starting up a new show with you. So we'll try to line up those videos with our shows, and then maybe it's useful for our viewers to have it. Also, what we are doing on IBM channel is that we are trying to challenge each other to stay fit and do some kind of an posture and exercise, which is not easy for the people to do it. So, can you challenge something to our viewers at this point of time so that we can try it out and let's see who is more fitter?
Run for 10 minutes without stopping.
Whoa, that's a good one. That's a very good one. I usually do a run for 1 minute stretch, but run 10 minutes. That's intense.
So, Dr. Rajat, also, I mean, people know how to run, but is there any, skill or a way to run smartly and, also take a breathe while doing it?
Right.
Because there are a lot of ways to run as well.
So you should run slowly. You should not run very fast. There should be like a brisk kind of a run, and you should deep breathe while running. So probably Ankit, you can demonstrate, and I can correct it.
Okay. So maybe for that we have to come up with a video basically, because this not be a good time to do it. But what we generally do is we share a posture and people try to follow that posture live with us, and then we see that how or fit we can. I mean, like any yoga posture or anything. That's what I challenged to Kimberly and she did it, and I think Willie also tried a couple of times. So, we tried to do.
Well, sometimes you have to challenge people to encourage yourself to go to that next level, right? And Ankit challenged me something I haven't done in a long time, and it was worth knowing that I could do it. Not perfect, but I could still do it. And now I'm re-engaging and doing my stretches every day after the show. I go outside, get some fresh air, and do my stretches. Stretching is very important. Yoga, stretching, breathing, just deep breathing. There's just so many things we can do to not just help slow down the pain that we're having, but also just to build our immunities back up. And it's easy to get depressed, but don't get depressed. Call us or email us at golive@ibm.tv, and we'll find a way to make you happy. We'll find you.
We were talking so and talk especially the tips shared by Dr. Rajat, and that's what one of the viewers mentioned, Shantanu Chakraborty, that we are doing good. That is what we require, and that's what our objective is.
It's kind of like
Ankit, I'll be sharing the.
Go ahead.
Yes.
Sorry, Ankit, I'll be sharing the videos with you, so you can definitely put them across. So I'll be sharing the back and core strengthening exercises by tomorrow, and you can put them on. So let's do this, and let's take this to a new level.
Let's do this.
Let's motivate people, and I
agree.
And that's a very good idea of doing psychological support groups online. So if you can encourage some psychologists to come in.
Absolutely.
And Dr. Rajat, we have discussed this in the past as well, that we should work on an app where we challenge people by doing those exercises, and we gain some points out of it, and then we can redeem those points in some kind of healthcare benefits. This is the right time to do it.
What do you think? Crowns, and if they get enough crowns, then they can go play chess stars with the crown.
Yeah. They can in fact
you have to
learn a lot of things from Rakesh ji and learn a lot of startup things from Willie as well. So I mean, that app could be useful in different ways based on your industry. Follow-ups or reach or maybe interest.
Yes.
So if you want to learn something as well.
Very interesting. A kind of currency linked with IBM TV. That's really nice. I have a response to Sasha.